Hello, my name is Felicity Dale and I'm the Director of Marketing and Enrollment at Dignity Health Global Education. I would like to welcome you all to a short info session about our Healthcare Project Management Certificate, which is launching this October. This online 8-week programme was co-developed with the nationally ranked American University, located out of Washington, DC, and carries 16 continuing education credits. I'm sure that everyone would agree that healthcare and healthcare-related industries are in dire need of improvements in efficiency to help lower costs and, of course, improving patient well-being and satisfaction. But without further ado, I would like to introduce our key speakers today, Dr. Sam Hanna, Associate Dean within the School of Professional and Extended Studies at American University, and Kristy Neckowicz, President at InVizion LLC and Project Management Guru. Kristy will be our specialist instructor for the first cohort, providing students with everything they need to succeed through the programme. Dr. Hanna and Kristy will be going through some of the questions that we have been asked by prospective students and employers alike. But before we dive into the questions, let's get to know a little bit more about Sam and Kristy. So Sam, if you wouldn't mind just introducing yourself and letting people know a bit more about you.
Sure, thank you so much. Hi everybody, Sam Hanna. Something interesting about me, I guess. I immigrated to the United States when I was 13. I did not speak any English, and I taught myself English by watching MTV. If anybody remembers that. I have 3 children. I have a 12-year-old daughter, a 10-year-old son, and I have a third furry 4-year-old dog. He's an English Springer Spaniel.
Oh, thank you, Sam. That's, wow, yes, MTV and English. I can't believe your English is actually so good, given that. So thank you for joining us. Kristy, over to you. Would you mind letting prospective students knowing a bit more about you?
Sure. So something that I would like to share about me is I have 3 grown children. I consider my greatest successful projects, and amazingly, all 3 projects, completed on time. They have miraculously turned 21 on their birthdays, which was great.
Oh, that's brilliant. Like I said, project management guru, lives and breathes project management. I can see how organized you are as well. Okay, so I think there's a couple of questions which I created, but then most of them are actually from, like I said, prospective students and employers. The one I did create was just to lay a little context into the partnership, Sam, between American University and Dignity Health Global Education, and just really, your perspective from the university about why you decided to partner with us with this program.
So I feel very strongly that partnerships in education are the key to unlocking the value that our students at all facets and all levels of their careers are going to need in the future. And I look at our partnership with Dignity Health Global Education as a value add to our students. It's really, it's at the intersection of very relevant and quality education that we provide at American University, as well as the healthcare space and the relationship that Dignity Health Global Education brings in terms of working with various healthcare providers across the United States and beyond.
Fantastic partnership, and we're very excited to get this program off the ground and any other future programs in 2021.
So are we.
So I think, again, before we kind of dive into more of the specific questions around healthcare project management, maybe we could do with a little kind of 101 about healthcare project management per se. So how would you explain project management in healthcare, and what does it typically entail? I mean, Kristy, over to you first, if you don't mind.
So when I think about project management in healthcare, the first tendency is to think about large projects, and that can be something like a large IT project in healthcare. Most of you in healthcare have lived through electronic health records projects, where they had to transform paper to electronic data, and that was huge. for all aspects, basically the whole supply chain of people in healthcare. But you can also think about project management in smaller, like almost everyday projects. Like some healthcare worker can think of a patient as a project, you know, from the moment they arrive to the moment they get well and leave your facility could be a project. How do you make sure that happens, you know, on time, on budget, and how do you manage the risk while they're there? There's so many different things that things that a healthcare worker does that can be considered a project, but they may not have that project management mindset. So what I think we want to do is translate the benefits, the terminology of project management to healthcare workers and, you know, healthcare professionals, their everyday projects that they currently may not call them projects, so that they can benefit from that knowledge and help them with their own professional growth.
So, like I mentioned, this program launches late October. We have a few intakes per year. But Sam, there are a multitude of project management qualifications out there. How have we come about creating this program, and what makes it different from the others out there?
That's a great question. You know, when you think about project management, you think about all of the things that Kristy mentioned. But, you know, now healthcare is going through a tremendous amount of overwhelming change in the age of COVID-19 and beyond.
Yeah.
Things like the actual, you know, infusion of devices and digital health is really causing a lot of pressure on the organization. And all of these, as Kristy mentioned, they're not just large implementations. These are day-to-day evolution that we all have to understand, learn, and have the skills to do. And that's why the essential skill of project management is so critical now, and everybody should have it. It's no longer just something that a project manager does. Everybody does some sort of project management in their daily routine and daily job. So what makes this program different is that it is not just about the tactical steps that you take to actually learn project management. It's about being a holistic experiential approach, whereby what you learn in the classroom, you can apply directly the next day at your work. And what you do at your work can be applied directly back to the classroom. And that's what sets this apart. It is something that you can live and breathe day in and day out while you're taking this course. And you don't have to wait to pass an exam to be quote unquote certified in it. You actually can practice it as you proceed through it.
Just to second what Sam said, you know, we try to work on this, this course so that people can take it to work and they can bring examples from work to their learning. For me, I think about people I've met, you know, who maybe have not thought of themselves as project managers, but they think of themselves as project managers. They miss sort of the nuance, the terminology that we teach in project management. And they can actually, for example, apply stakeholder management in project management to what they do at work. You know, at work, you're dealing with a lot of stakeholders, and you do have to do a lot of stakeholder management. And maybe it would behoove you to look at the, you know, responsibility assignment matrix for the stakeholders that you're dealing with at the moment and figure out who needs from you. You know, so we give them techniques to take work and that they can use the next day. It doesn't have to be when the course is over or when they get a certificate, then they'll look for a project to apply it. You know, it's very pragmatic and I would say very relevant.
Well, I think then we've answered the question that was next about learners searching for kind of PMP or PMBOK training. And I mean,
you can still ask.
Yeah, I feel like we've almost, you know, we've answered that, but like what does this program provide that PMP or PMBOK kind of training don't?
If I may, I would say it provides the skill sets and the ability to be able to pivot and adapt to a changing environment which is an essential skill of a project manager, because things change all the time. You know, imagine what healthcare was like just 6 months ago before COVID-19, and look what we're doing now. You know, imagine how everything moved overnight almost from physical. You go see your physician and doctor and nurse in the clinic to it went to telehealth and telemedicine. All of that, the infrastructure, the bandwidth, the technology, the training that had to happen. And that could not have happened without healthcare project management.
Yeah.
Here we are. The world is different now, and we Zoom healthcare via a video conference with our physician, our doctor, our GP.
That's a good point. Also, that there were a lot of other changes in healthcare other than the information technology. If you think about it, the work of the healthcare professional has changed a lot, and there are certain workforce planning projects that had to take place. You know, different people are working different shifts, and some of the positions are no longer needed. You know, so there's ramping down of certain jobs, but then ramping up of other jobs, right, to fit the needs that COVID-19 has brought us. So all of those could be thought of as projects. And I think a traditional PMBOK-based course would probably compartmentalize what you're learning for taking the exam as opposed to for applying it to your work right away. That was one difference. I think another difference is if you're taking a certification exam, you have to learn different aspects of project management, whether or not you need to use it at work. What we've done for this course is that we've taken the more important aspects for healthcare, like quality, you know, and we've expanded on that compared to your traditional healthcare courses. And I think for risk management, for example, we would look at it through the lens of, in the healthcare environment, what type of risk are we talking about? You know, it's a lot more than just on time and on schedule type of risk. And similarly, we de-emphasize certain aspects of the project management foundations course, like procurement, for example. We already have policies and procedures in place for procurement, and it's handled by a different department. So you only need to know some high-level procurement concepts for project management. So I think, you know, we work with very talented people from Dignity Health and University to hone in on exactly the right level of content that we need that would be relevant to today's professionals.
Thank you. I think that definitely covers it. So shifting more to like the actual learning experience within the program, which we at Dignity Health Global Education pride ourselves on in terms of just, you know, having that, you know, we built our programs to be online pre-COVID. And, you know, obviously a lot of institutions have had to shift things online, but we built this to be online so that it was for the workforce and, you know, people could take it, but also we really want people to, you know, enjoy their online experience wherever they are, whatever they're doing, you know, whatever time in the day or night they want to study.
Yes.
And one of the key things about our online learning experience is we have, like I said, like kind of gurus or specialist instructors or facilitators, whatever we wish to call you, Kristy. So you'll be actually guiding students through, you know, through the program, and they're on hand to help answer any questions and obviously engaging in the discussion boards with them. How do you feel that you being there will, you know, will help learners succeed through the program, and what can you provide to them?
I feel like the biggest thing is to engage the attendees, the users, so that they can share their experience, so that I will be able to provide advice or provide that linkage to explain to them, you know, the terminology differences between what they're hearing at work and what a typical project manager in the real world may call something, and provide them that opportunity to see, oh, I am doing project management and I can use this concept that I'm learning in class to this problem I have at work. So I feel like my job is kind of a translator when I'm facilitating. So I'm going to translate project management concepts and theory to what the students are bringing to the discussion boards and to the, to the homework, to the extent that we have some.
And if I may add, we are certainly very fortunate to have somebody of Kristy's caliber, teaching in this course. And, we do pride ourselves at American University that when we have instructors teaching such a course, is that we bring instructors who actually have done this in the real world, who are professionals. And that makes a huge difference in that we're not just talking about theoretical items, we're actually talking about practical applied learning.
So Sam, how do you feel that COVID has affected the need for great project management across healthcare and healthcare related industries?
I think it has tremendously in that, we talked about how it impacts everybody in healthcare, no matter what level and what functionality you're working in. However, if you think about, the things like supply chain, laboratories, claims, things like, the actual receiving of care from from the doctor through a portal, all of that requires a new level of thinking and a new set of standards that you have to apply. If you are doing testing for COVID and you work in the laboratory, that changes your operations. And that requires you to project manage a whole new set of procedures and policies in place. If you're in supply chain and you're trying to get test kits and PPPs and masks to the providers on the front lines, that requires, massive project management skills to make that happen. And we all know how we struggled, as a world, with our providing all of that to our providers, our first line of defense, our first line workers. So that is how COVID has impacted that. In that now when I speak to clients and colleagues at various health organizations, they have really been focusing on this and building infrastructure to support further project management of these types of issues, as the future, is uncertain of how long this will be and how it's going to impact everything else.
Who would you recommend this program to? Someone is looking to upskill or reskill, inquisitive, maybe toying with the idea. What are your thoughts around that? And Sam, I'll go to you first, if you don't mind.
I truly believe that a course of this caliber really applies to all levels of the organization. An executive could benefit from such a course in that it enables them to see things holistically and big picture and really understand the change management impact of the decisions that they will be making. A mid-level manager, whether clinical or non-clinical, could benefit from this in the way they project manage their teams and the various essential functions that they have. And then line workers at various levels, whether you're a clinical person, a non-clinical person, an intake person, a claims person, no matter what, could benefit from this in that this really provides them the day-to-day skills that they need to implement so they can achieve the goals of their division, their organization. And also personally, it would help them skill to advance their own career. So I do truly believe this really applies to all levels of the organization. And what you do with it depends on what you do in your job and what you want to do with your job afterwards.
Yeah, I agree with what Sam said. I think that anyone can apply all the different aspects of project management that we're going to cover in the course based on the needs of the job, at that time, or in preparation for their next job. So I feel like at any level, they can benefit from this course. We teach them how to, look at iteratively the cost impacts, schedule impacts, quality impacts, and risk impacts, for example, of everything that they work on. And that can be, it could be something on a small scale involving a few people or a few customers or patients, or it could be a very large scale project, like, you know, trying to administer vaccine to millions of people, you know, a project like that. That could be it, you know, either project could use good project management. So I think at any level, anybody in healthcare can apply this, even as a review if it's been a long time since they've taken project management classes.
One other question around audience I have would be, would you recommend this program to, you know, people who aren't working in a hospital or a healthcare facility per se and are working in industries related to this, so medical device, you know, even pharmaceuticals or even healthcare consultancies?
Healthcare is a very complex, adaptive system, and it's always evolving. And every piece of it, as it evolves, it impacts all other aspects of this ecosystem. So if you work for a medical device company, your device may impact the way we treat patients. So it's essential for you to understand how the healthcare system works so you can insert yourself into it and impact change. You know, if you're in the pharmaceutical industry, it's the same thing. If you're in the financial services industry, you need to understand how claims work, how payments work in healthcare, how the insurance system works, if you are intending to deliver your services in a healthcare setting. So I do believe that understanding healthcare through this course is helpful to anybody from outside the industry who is interested in coming into the industry, either in switching careers or also in working within the healthcare industry as a service or a solution.
You know, one thing that I really benefited from with our program was the network of people. You know, what a fantastically diverse cohort that, I mean, actually all of our programs have, in that you build those lifelong connections. And I think, you know, career advancement, professional advancement, even business advancement, you know, making connections in different industries that you can actually benefit from long term, and your company can too, is really part of the, you know, overarching experience that we have and will have on this program as well. So yeah, I agree with that.
I would just add that we don't, in the course, we don't actually teach you about, for example, how insurance claims work, but we teach you how to look at that with your project management lenses on, you know, so we don't go into the specifics of this is the process that you go through in this industry, but we do bring a lot of examples up when we're talking about the topics. So, you know, don't come to our course to learn how insurance works, but come to our course to learn how you can apply the project management concepts to your insurance projects, for example.
Yes, if you're looking to learn about the details of how the healthcare industry works, then we are working with Dignity Health Global Education to develop a health administration master's program, and that's where you go to learn how the industry works.
As I mentioned, project management guru, what advice would you give to someone looking to move into project management as a career? Advice
for somebody who wants to move into the project management career would be work on people skills as well as the hard skills that we teach. Because in project management, you don't necessarily have direct management control over your stakeholders or your team members. So you're going to have to use certain skills like influence and use your leadership skills to complete the project with the help of other people, even though they don't report to you. So I think that's one piece of advice that tries to get into project management. It's a little bit different than the traditional management ranks.
I want to thank you both tremendously for taking the time to meet with us and talk through some of the questions that we've been asked. And, you know, just to, you know, potential prospects, please note that, you know, this isn't the exhaustive list of questions. If you have any questions, we would be happy to take them. And, you know, I can liaise with Sam and Kristy and get the answers to your questions with our enrolment team at DHGE. And yeah, thank you very much for your time.